I'm Dr. Parker, and we're here at Paradigm Hormones today. And I was going to ask if you've ever experienced fatigue or periods of anxiety or weight gain. If so, you might have undiagnosed PCOS. And PCOS really stems from insulin resistance, and the body's cells lose their ability to respond to insulin. The insulin level goes up, and your blood sugar goes up, and that causes periods of foggy mind, and it causes periods of anxiety. It also causes irregular or painful menses, which is one of the main symptoms of PCOS. It also causes mood swings and, again, anxiety. So let's see. So what I looked at is I broke this down into some of the usual signs of PCOS, which are pretty easy to diagnose. But again, I'm talking about undiagnosed PCOS. I'm looking at some of the more unusual signs of PCOS or symptoms. And about 50% of women get undiagnosed with PCOS that really have it. They see their doctor, they get tests, they don't know what's going on. They have fatigue, or they're not feeling right, or they feel poorly and they're anxious, and nobody understands and can figure out what's wrong with them. So really, we want to figure that out. We'd like to treat that. And anyway, so I want to talk about some unusual symptoms. So again, I mentioned fatigue, the anxiety and depression. So depression is certainly one as well. Sleep trouble, especially sleep apnea. You can get unusual rashes, so you get dark rashes in the folds of your elbows or your neck or under your arms. So that's a typical sign of PCOS. You can have food intolerance and get insulin resistance, which I mentioned, and lipid abnormalities. So you may have your lipids checked and wonder why your cholesterol is elevated, and nobody can explain it. You might have PCOS. So, all right, So these are kind of textbook symptoms of PCOS. It's typical to have enlarged or polycystic ovaries. So really that is what led everybody to think many years ago that everything to do with PCOS was just the ovaries. But actually the ovary enlargement is just a response to insulin. And the insulin causes lots of effects in the body. Okay? So you can have irregular menses or amenorrhea. You can have acne or hirsutism with that. You can have weight gain, or you may not. About 50% of women with PCOS don't have weight gain. And you can have infertility issues if you're trying to get pregnant. It's certainly one of the things to think about. So, okay. And really, I looked this up. PCOS is one of the most common endocrine, or is the most common endocrine disorder in premenopausal women. It affects more than 10% of all women, and it may be even up to as high as 20%. Okay. The diagnosis of PCOS. Again, one of the first things is an abdominal sonogram or CAT scan. You may or may not have had that done. It doesn't always show polycystic ovaries, but that's one possibility. But the biggest issue is to look for an abnormal LH to FSH ratio. So that'll really tell you, if your LH ratio is above your FSH a certain level, you probably have PCOS, and you've probably been undiagnosed too. So sometimes we'll measure the insulin level or the fasting blood glucose, and that's a way to start getting to the bottom of that. We evaluate your lipids, like I said. We'll check your good cholesterol, your HDL. We'll check your bad cholesterol, LDL. PCOS will make the HDL go down, and it'll raise the LDL, and it'll raise your triglycerides. So again, that's something to think about. A lot of times we'll evaluate for your 17-hydroxyprogesterone if we're looking for other tumors or other reasons that you could have these symptoms. And we don't do that every time, but that's something that we check. And then we check the free testosterone level. So many times when we have PCOS, we'll have elevated testosterone, but sometimes they don't. We'll still check the free, and usually the free will be elevated, even if the total or serum testosterone is normal. So, okay. So the treatment options, in the old days, the treatment was to do a wedge resection of the ovaries, which that went on for many decades, and that helps for sure, but it doesn't really treat PCOS. The bottom, really the biggest treatment for PCOS is metformin, and not everybody needs that, but certainly that's one of the big treatments for PCOS. And what it does is it helps with that insulin resistance. And we can give that in pill form, or we actually, if you can't tolerate the pill, because some people get diarrhea or stomach cramps, we have a cream, a lipoderm cream that we can use for metformin. A lot of times we use high-dose thyroid, and that kind of depends on your levels, but certainly that's an option, and that can, sometimes thyroid alone will stimulate you to have ovulation and have normal periods. We have other medicines other than metformin. We have Januvia, which is new, and we have Trulicity. And some of these medicines have been shown in the paper, in some articles recently to show signs of weight loss. That's a side effect that happens. It doesn't always happen with that, but it certainly could be. We sometimes use micronized progesterone for that, and that'll help with a lot of the anxiety symptoms of PCOS. And we use spironolactone for some of the acne and some of the hair issues that occur. And then bottom, I put as birth control pills. And that, again, wedge resection in the past, birth control pills were the main treatment. But neither one of those really treats PCOS, it just kind of covers it up. There are other things we can do to help that really will treat it. So, okay. And then the other thing is I wanted to mention was laser reduction of acne, which we have here that we can add to that. So, okay. So long term, the complications of PCOS are type 2 diabetes, and that's the biggest issue, and that causes many long-term consequences: heart disease, stroke, many sequelae of diabetes. So, and a lot of times that comes strictly from PCOS that's been untreated. So the earlier you treat it, the better chance you have of not getting diabetes. So the other long-term complication is have anovulation, so you have no ovulation at all. And then another long-term complication is weight gain and then hypertension, secondary to the diabetes, high lipids, which I mentioned here, and then the weight gain. And then this rash is what I'm talking about, where you have dark rash in the folds and under the arms and so forth. And that's just one of the kind of, if you see it, it's almost pathognomonic for PCOS. So you get endometrial hyperplasia from PCOS. Then again, you have elevated cholesterol and lipids. The HDL, as I said, will low, and the LDL will be elevated. And then worse is over a long period of time, you have an increased chance of breast and endometrial cancer. And in fact, the levels can be reported as even 4 to 5 times higher than the public. So again, that's untreated. If you treat it, you're going to be able to decrease those risks. So anyway, I want to go over PCOS today, and I want to make sure that you knew about it. And again, some of the more unusual and undiagnosed cases of PCOS. And I'm Dr. William Parker at Paradigm Hormones.